Hi, welcome to the Center for Psychedelic Psychotherapy and Trauma Research. This is our fourth meeting in the Mindset Educational Lecture Series. Today we have a very special guest. He'll be interviewed by Dr. Rachel Yehuda, the director of the center. During the course of the lecture, please be sure to enter your questions in the Q&A box down there, and we will assume you're able to come up on video to ask your questions to Mr. Pollan at the end. And now over to Rachel.
Thank you very much, Lauren. And today we have a very special guest, Michael Pollan. And Michael Pollan is a renowned best-selling author and journalist who's currently the Knight Professor of Science and Environmental Journalism at the University of California in Berkeley Graduate School of Journalism. And he writes books about where nature and culture intersect, such as On Our Plates, Our Farms, Our Gardens, and Our Minds. And his books are award-winning bestsellers and have unbelievable impact on society. And just to name a few of these books: In Defense of Food, An Eater's Manifesto, The Omnivore's Dilemma, The Botany of Desire, and his new one coming up, This Is Your Mind on Plants. But we're here today because Michael Pollan has written How to Change Your Mind, which was named one of the New York Times 10 best books of 2018. And this is a book about consciousness and about psychedelics. So welcome to Mount Sinai, Michael.
Thank you, Rachel. Very good to be here. Very exciting to hear about your program too.
Very exciting to hear about yours, and we'll talk about that in this next hour. But I wanted to start by telling you just a little story. I bought your book for my husband soon after it came out, and it made him want to try psychedelics. And the fact that I had already decided to devote the rest of my career to studying them as a treatment for PTSD had not actually made an impact. But there's something about your journey and how you write about it that a lot of people related to. And I just want to start out by asking, do you have any thoughts about why so many people who had never even thought about doing psychedelics wanted to try them after reading your book?
Yeah, I do. I mean, this happens all the time. I'm always hearing from people, especially people looking for referrals for guides and things like that, which I can't offer anybody, for obvious reasons. I think that in the book, since I come to the field as a skeptical newbie, I'm not someone who had used psychedelics in my youth. When I first heard that Johns Hopkins and NYU were giving psilocybin to cancer patients, terminal patients, I thought it sounded like a crazy idea. So I kind of embodied the average person's skepticism going in. And once I learned more and started talking to patients who shared these incredible stories of transformation and healing, and then decided, well, I've got to see what this is like from the inside and have this experience myself. And I describe a series of experiences I had on different substances. And that they were on balance very positive and incredibly enlightening. So that I think the reader can identify with me more than perhaps your psychedelic enthusiast, because most of what's been written about psychedelics before my book has been written by people who were completely sold on the idea, had been using them a long time, and didn't understand reluctance or skepticism at all. So the fact that I had one foot in another world and one foot in dipping my toe into this new world, I think made it easier for people to come along on the journey.
Yeah, I think I agree with you. There's a lot of value in hearing about psychedelics from somebody who had to go through the process and starting out being skeptical. I mean, and of course this
and
is
frightened also, by the way.
I'm sorry?
And frightened. Well, I also started out being fearful.
Yeah.
And that too is where many people are on this, that this is scary stuff, that don't people lose their mind on these drugs? Don't horrible things happen? Don't bad trips land people in the psych ward? I mean, this is in people's heads. And it was in my head. And so that the fact that I gradually was able to peel away a lot of those misconceptions through research and really understand the risk, because there are risks, by the way, but they're not exactly what people think they are. I think that also allowed people to get more comfortable. I found, when I went out talking about psychedelics, I would be in a room of people and I'd say something positive, and just talking about psychedelics as medicine rather than thrill seeking or recreation. And I could feel people clench in the room. You'd read the room and you'd see, and it was usually a woman with children at home. And I could just see the clenching in the jaw and realize that this was very challenging, that I was saying anything positive about these evil substances. But the more I talked about it and told my journey and explained, here are the real risks, here are the fake risks that you hear about, I could sense somebody relaxing in the room.
Yeah, so you're coming from a place of skepticism. I'm still interested in what really drew you into the other side, and was it actually having an experience yourself, or were you much less skeptical just as your own misconceptions started to, just as you started to realize that you had misconceptions about this?
Yeah. So there were two steps to the process for me. The first was talking to patients. The narratives of cancer patients. I started out on this journey with a piece in the New Yorker called "The Trip Treatment."
Hearing you.
Yeah, you're a little bit halting in your audio feed.
Better now. Yes. Yeah.
Okay. So I started out, I did a piece for the New Yorker called "The Trip Treatment" in 2014, which you can get online if you search "The Trip Treatment." And for that piece, I focused on the trials at Hopkins and NYU, giving psilocybin to people with terminal illness or who were paralyzed by the fear of recurrence of their cancer. And I talked to probably a dozen people who'd been through that trial, and their stories were so powerful. Stories of overcoming their fear of death. And I told the story there of one particular person who I never met, Patrick Metis, who was my age. He was a journalist also, and he got cancer of the bile ducts, and had an experience on psilocybin that completely lifted the terror that he was feeling. And so I was privileged to read the notes that he wrote about the experience, his therapist notes, which his wife shared with me, and interviewing his wife at some length. And stories are powerful. And that story for me made me realize this is something we have to take seriously. We may not know entirely how it works. But here is a group of people, we have very little in psychotherapy to offer. The main pharmaceutical for people who are dying, of course, is morphine, which dulls the mind rather than sharpens it or helps it cope in a meaningful way. And so that for me was the first step. And then the second step was, frankly, I was envying the experience these people were having. I had never had a spiritual experience, I don't think. And the idea that people who were, materialists and atheists like me were having these transformative experiences, I became intensely curious to see what that was like. And then had this series of experiences that were transformative for me. I mean, I wasn't trying to heal anything, but I was trying to learn things about myself and nature, and they were remarkable. They weren't easy. Sometimes they're very difficult. I think the idea that people take these drugs for thrills is a little hard for me to understand, because it can be very hard work as difficult material comes up. But I was in good hands. I worked with some very experienced guides, although of course because of the nature of the legal status, they were underground. What I was doing was illegal. What they were doing was illegal. And to see that begin to change is kind of thrilling.
Yeah. What would you say the most common misconception about psychedelics is that have to be dismantled, specifically in the medical and scientific community?
Well, the word psychedelics now is being used to embrace several different things. And MDMA, whose street name is ecstasy or Molly, is often lumped with psychedelics. But then there are the classic psychedelics like psilocybin, LSD, DMT, mescaline, that work on a similar set of brain, receptors, and have a more similar risk profile. But the first is that they're dangerous drugs. And indeed, the government says they're dangerous drugs by putting them in Schedule 1, which says a drug has a strong potential for abuse and no recognized medical use, neither of which is true. But nevertheless, that's the legal status. So I think that's the first misconception. A drug of abuse is one that's addictive. And one of the most striking things about the classic psychedelics is that they're not habit forming. Your first thought after a big psychedelic experience is not, when can I do it again? It's more like, do I ever have to do that again? And indeed, in the classic studies, where you give a rat 2 levers and one has a addictive drug in it, like cocaine or heroin, and the rat will keep pressing the lever to administer that. If you put LSD in that setup, and they have, they'll try it once and they'll never go back. So the drugs are not habit forming. That's important for people to understand. The second thing is that they are, again, speaking of the classic psychedelics, remarkably non-toxic. There's no established lethal dose for psilocybin or LSD or mescaline. And that's a remarkable fact when you consider that there is a well-established lethal dose for drugs you have in your medicine cabinet that you bought over the counter, like Tylenol. So you can't kill yourself with an overdose. There are risks, though. I think it's important to be frank about it. And the risks are psychological. I mean, there's certain people, especially people at risk for schizophrenia, either by family, lineage, or people who have certain personality disorders. They think mania is a counterindication, that shouldn't go near these drugs. They're really suitable for people who, it appears, whose brains are kind of stuck in a very rigid pattern of thought, rather than people whose brains already have a little too much chaos. And because they push you in the direction of entropy, basically. I mean, that's one prevailing theory. And used improperly, people can have terrifying experiences and their judgment is compromised. I mean, it's not untrue that certain people have jumped off buildings and done crazy things on psychedelics. You need to be in a safe place. You need to be with someone who understands the territory, and can help you get through what can be terrifying episodes. The bad trip is a real thing, but in the therapeutic context, the bad trip can become very helpful if it's processed with a good therapist. And in fact, most therapists don't like the term bad trip. They talk about a challenging trip.
Yeah.
But when you're being properly guided, you can work through the bad trip and get to a happier place, and also process the material in a way that can be incredibly useful. Okay. So context is everything. What is psychologically dangerous outside of the therapeutic room can be psychologically salutary, very helpful inside. So context has to be, people have used these drugs in some crazy ways, beginning in the 60s, because we didn't really know how to use them. They burst upon our culture. We had no tradition the way, say, the Native American church does, or certain traditional cultures. They had used these powerful substances for thousands of years, and they used them with respect and intention and with a container. Suddenly we had these new chemicals, and people were going to concerts and taking large doses of LSD, or walking around a city, or putting themselves in really crazy environments. And yes, some of them did end up in the psych ward. And there were people who had psychotic breaks.
Yep.
And we have to acknowledge that.
Yeah,
but for the most part, it was about context.
so that actually, it's a great segue into what I really wanted to talk to you about today, because we have just started a psychedelic center here at Mount Sinai. It's actually psychedelic psychotherapy and trauma research. We're going to focus mostly on PTSD and trauma-related disorders. And I know that you're also involved in the Center for Psychedelics at Berkeley. So I want to ask you, what kind of science do you think will move the needle in terms of larger scale acceptance or alleviating the stigma associated with psychedelics as drugs of abuse or harmful? And what do you hope to see will happen in the scientific space or in clinical trials?
Well, I think that, successful clinical trials is going to move the needle. I mean, bigger ones. We're moving toward phase 3 of trialing psilocybin for depression. We're already there with MDMA, and although it hasn't all been published, they're very encouraging results on using MDMA to treat trauma. And these studies will speak for themselves, and I think will persuade the psychiatric and psychotherapy community. One of the things that I've learned along the way, and you may know this already, and the people listening may know this, is that the mental health profession is acutely aware of the limitations of the tools it has, and that is desperate, and I don't think it's too strong a word, for new and better tools. And that SSRIs only take you so far. They work for some people, but they have serious limitations. They, in fact, are habit forming, and that people don't like taking them, and they're hard to get off. And they work slightly better than placebo, but that's about it. So when mental health professionals learn about some of these trials, they tend to be very excited and not satisfied yet about the data and wanting to see more of it, without question, but more open than I expected. I expected to get a lot of pushback when I published this book, especially from prominent psychiatrists and psychologists. And it was the opposite. They were all like very excited, very charged up, very open, with questions, with skepticism. So I think that the trials themselves will be the most important thing. The other thing, though, is we do need more basic science to understand how it works. Now, we know medicine's full of cases where people have discovered a treatment and they have no idea how it works. SSRIs are not a bad example. I mean, we know less about them than you might think. I remember writing in the first draft of the book that I was talking about SSRIs, and I said they increase the level of serotonin in the brain. And a neuroscientist I had vet the chapter said, that's never been established. That's remarkable. But we still use them. And so it's not absolutely necessary we figure this out, but it would be, I think, very helpful if we could point to a very kind of mechanistic understanding, because it's such an interesting kind of drug, because we're really not sure whether it's a physiological change that's happening, or that it is the experience that people are having that is leading to the change. Is it experiential or is it pharmacological primarily? A lot of people suspect it's experiential, but it would be very interesting to see and really understand what's happening at the level of the brain, and why a single administration of a drug should have an enduring effect. And there is some before and after imaging going on, which perhaps will answer the question. I suspect it won't, but I suspect it all happens in the realm of a powerful experience that does reset the mind.
Yeah,
But I think that research, I think, would bring more people along.
I agree with you on that. I'm not sure that just pharmacology is going to get us where we need to go. And I have likened this to kind of understanding PTSD, that understanding what happened at the time of trauma doesn't really explain that much about why you have a transformational experience that endures. So I completely agree that it's going to be more the biology of the experience, whatever that means. So hopefully we'll see some really good work in neuroscience. I'm sure that a lot of people will ask you some questions about that because this is a highly neuroscience focused group. But I want to sort of pick up on something else.
They're fascinating questions to be answered there.
Oh my goodness.
I was just going to say,
Yeah.
if for a neuroscientist, I think that there are so many interesting questions that can be put to psychedelics, and that they, in the same way they're showing themselves to be a tool for therapy, they may well turn out to be a tool for understanding the brain.
Yes, I agree. So I want to go back to something else that you said, because you're talking about your own experiences. Um, there, I think that there's a tension in our field between this idea of wanting to legalize psychedelics, or wanting to at least vet them so that they can be FDA approved treatments for various mental health conditions on the one hand, but then on the other hand, wanting psychedelics to kind of be available to everyone so that they can self-actualize, or maybe deal with a certain circumscribed problem like smoking or a terminal illness, or as in your case, get in touch with spirituality. And in your book, you quoted Bob Jesse, who talks about the betterment of well people. But it's a very interesting question of, should we cross this divide between therapeutic use and curiosity, introspection, and fulfillment, or whether it's best to leave psychedelics in the therapeutic realm so as to hope to avoid this whole question of people taking it on their own, which led to the banning in the first place.
Yeah, my own sense about that is that the drugs have a lot to offer people who don't have a mental disorder. In the same way that weekly talk therapy offers a lot to people who aren't sick. That people seek psychotherapy for a lot of reasons. They may be not clinically depressed, but sad. They may be, not clinically anxious, but worrying. They may have problems in their lives. They may have problems in their relationships. They may have a loss of sense of meaning. All the reasons that people often get benefit from psychotherapy apply here. And so I think it would be a mistake if some of these substances were limited only to people with a serious clinical diagnosis. I'm open to the spiritual use of these substances too. And I think we will find, in the same way, that now Native Americans have the legal right to use peyote, which contains mescaline. And there are 2 ayahuasca churches that have that right too in America. I think you're going to see a parallel growth in a sacramental use of psychedelics. And that makes medical professionals a little nervous. And yes, there is the risk of a backlash if you have another wave of people using drugs in an unregulated way. But even though I support this idea of the betterment of well people, I'm acutely aware of the fact that in the same way in medicine, we have this very carefully crafted container in which the medicines are used, with the 3-step, the preparation and the accompaniment during the session and the integration afterwards. I think even in the more cultural use of the drugs, you need the container. I think that's one of the most important lessons. If you look at how traditional cultures have used these substances for thousands of years, literally, you find some very helpful guidelines. I mean, one is that there's always an elder involved, somebody who knows the territory and can guide people. There's always a sense of occasion. It's not done casually. It's done for a very specific reason, and usually with an intention. And often in a group setting, which I think is interesting too. So that the challenge before us is devising a cultural container that feels right for us. I mean, a teepee ceremony with a fire is right for Native Americans. It might not be right for the rest of us. But there are things we can learn from that ceremony. So I think in the same way we still have medical research to do, we have a lot of cultural work to do to devise that container. But I do think it would be a shame if medicalizing psychedelics is the only thing that happens.
Yeah, I mean, I struggle with this issue myself because I do think that without a boundary, this can lead down the road to abuse or people that use these drugs without the proper, as you call it, container or guidance or integration. I'm sure you'll get a lot of questions about that. I just only have one or two more questions before turning it over, but this one I'm really interested in your thoughts on. Of course, I envy that you've been able to talk so openly about your psychedelic experiences, and as you can imagine, not everyone has that luxury.
No, nobody in the field would let me would go into that with me, and I understand why. I think at this stage it's very wise. I mean, I have a freedom that other people don't. Although, you know, this book was expensively lawyered before I published it, so there was some worry and you know, and concern that I was in fact admitting to breaking federal drug laws.
Well, my question isn't so much about the legalities. I mean, my question is more a conceptual question about really whether, let's say, scientists who study psychedelics without taking them are different than those who don't. And would that make them more trustworthy, or would that make them less objective? And it's also true when you get into the clinical arena, because there really are some very interesting discussions happening about in the context of training psychedelic therapists. And would you go to a psychedelic psychotherapist who have never tried psychedelics? And you can imagine that this is a kind of thing, whether you personally disclose it or not based on your own set of legal concerns, it's really a conceptual question. Does it take one to know one? And, you know, how important is this really versus, you know, I've studied a lot of things in my life without taking them or without having to imagine what it would be like just from the data. And so this is an audience of scientists. A lot of ketamine work has been done here by people who I'm sure have never taken ketamine. So talk a little bit.
Yeah, I think it's a really interesting question. My sense is that there are very skilled therapists who could do a very good job without having taken psychedelics.
I agree.
And but I also think that it would be easier if they could. Those who wanted to. I don't think anyone should feel compelled. I don't think it should be a requirement of a training program, but I think it would be wonderful if it could be an option. I think that there's certain, I mean, you know, people often talk about the experience as being ineffable, okay? Indescribable, literally beyond words. That's a challenge to a therapist. And when your patient has had a experience that is completely beyond words. And it would be helpful if the therapist had had an ineffable experience of his or her own. So, you know, one of the things we're working on in this Berkeley Center that I'm affiliated with is devising a training program where we could offer the experience to people who wanted it. And the way we're hoping to do that is, since we're going to be essentially doing basic science for whom we need healthy, normal subject populations, that why not draw that healthy, normal subject population from a training program, whether it was ours or someone else's training program. Yeah. So we're hoping to be able to do that. I think it's important in general in American medicine, and this may be true globally too, the assumption is that your objectivity is compromised if you're doing a study of a drug that you have used. It's important just from a historical point of view to understand that the opposite belief was quite powerful pre-1960 or so, where it was considered irresponsible to administer a drug that you hadn't tried, a psychiatric drug that you hadn't tried yourself. And all the early scientists, Humphrey Osmond, Abram Hoffer, that whole generation of 50s scientists who really, we're now standing on the shoulders of, who did the first psychedelic research, they got important insight about what they were doing and were led away from wrong ideas by the fact that they tried the drugs. So, for example, when at the beginning of psychedelic research with LSD and mescaline, they decided, and they called the drugs psychotomimetics, that they essentially induced a state of psychosis, and their value would be specifically to let therapists experience what they called the mind of the madman, put themselves in the shoes of the madman. And this, it presented like psychosis. There was depersonalization, there was hallucination. So you could see how a researcher who hadn't had the experience might come to that erroneous conclusion. But then Hoffer and Osmond, and these were two key psychiatrists who did work in Saskatchewan in the 50s, decided, well, we better see for ourselves. So they had a series of experiments with mescaline and then LSD. And they were like, oh, this isn't psychosis. This is something else entirely. And so that name, psychotomimetic, was thrown out. And they moved to the word psychedelic, which is a very good word, even though it has all this 60s baggage attached to it, that simply means mind manifesting. That these drugs seem to allow repressed or unconscious material into this observable space. So all I'm saying is we've learned important things from smart therapists and researchers taking the drug themselves, and we're now we have a taboo on doing that. My sense is most people in training are getting the experience and they're doing it underground. My sense is a lot of the researchers have had the experience, but they can't talk about it safely. Maybe we'll get to a point where they can. I mean, in the same way that my ability to tell the story of my experience has opened this field up to other people, I think it would be useful if people in training programs could do the same thing. But as I say, as they often say about skilled therapists, any theory, they can have any theory, they can have any medicine, and they're going to do a good job. They just have a touch. And I think that's true for psychedelic therapy too.
Yeah, we're doing the exact same thing at our center. We have plans now to develop a protocol very similar to the MAPS MT1 study that I participated in.
I gather the FDA has only offered limited opportunities for that so far, and I hope the FDA will see the virtues of letting trainees have the experience again if they want it.
Yeah, well, Rachel's waiting. Maybe I think it's been hard maybe to keep those studies open. And so a lot of trainees who've completed the MAPS training haven't yet gotten to go through MT1 or MT2 if they're interested. So I hope that becomes more available.
Yeah, I hope so too. I think it's important.
Yes, so I think that we're going to be working with MAPS though, and we are going to ask scientific questions just like you. So as we do biomarker work with our PTSD and trauma group, then we can also do biomarker work with normal controls. This is an important question because we don't know whether psychedelics are actually reversing any kind of process associated with an illness, or whether something entirely different is happening and whether that's something that's universal. So if somebody no longer has post-traumatic stress disorder, does that look the same as somebody who has become more spiritual as a result of a psychedelic experience? And I think that these are very interesting questions to ask. So I guess my final question—
I couldn't agree more.
Yeah, great.
Yeah.
My final question, I guess, before I turn this over is, whether you would say that there's a before psychedelic Michael Pollan and an after psychedelic Michael Pollan.
You know, yes, in some ways, but pretty subtle. My wife would say so, and she's the best expert I think I have on me, or maybe my son also. But she felt after I had these experiences, I was someone who was more open about expressing emotions, that I was that they were more available to me, that I was more patient, because I can be a pretty impatient person, and just kind of more introspective. But you know, a lot of things happen after psychedelics. One thing that happened for me that's not at all uncommon is I began a meditation practice. And one of the benefits of psychedelics is that they make that easier to do. I think someday we'll use psychedelics to begin a meditation practice because they kind of introduce you to the space that you want to occupy in meditation. A lot of the psychedelic experience is not what people think of, these like dramatic visual experiences and you know, where you've lost control of what you're thinking about. That happens at a high dose for a little while, but then there's this long tail, which is very much like meditation, where you can direct your mind where you want to go, but you can really work on problems or think about things with incredible single-mindedness. And it is, I think it's a really perfect training for meditation. So all I'm saying is that these changes are part of other changes that came after having had this experience. But I've seen many people I know, many people close to me, use psychedelics to work through troubling relationships with their parents, for example, obtain peace about something that had just kind of tormented them for a long part of their lives. So I've seen a lot of change around this, and a little less in myself, I guess, than other people. But yeah, I would say that there is a before and an after. Yes.
Cool. I thank you so much for answering these questions, and I'm very excited to hear what our listeners have to
Me
ask.
too.
Yeah, so I'm going to turn this over now to Lauren to moderate the discussion. We already have some questions coming in, and just keep them coming. And thank you so much.
My pleasure, Rachel.
Great, thank you. So yeah, I just wanted to quickly say that for audience members, please join us tonight at 5:30 if you're free. We're going to have a discussion on healing from collective trauma, and some of the questions that I think are asked in the chat about how to get involved with the Center at Mount Sinai. We can talk about that more together as a group. But I think we'll begin the questions. So yes, please send them into the Q&A box. But we're going to start with Josimar up here on our panel, who has a question.
Hi. Thank you so much, Michael, for being with us today. We really, really, really appreciate it. So my question is, in a country with so much trauma over the last year, how do you think psychedelic medicine could change our society for the better?
You know, the whole issue of the social benefits of wide-scale use of psychedelics is a really complicated one. There's a long history of people who believe, and this includes Timothy Leary and Aldous Huxley and a lot of the kind of people who were promoting psychedelics in the 50s and 60s, who believe that psychedelics has the power to increase empathy, openness, people's sense of connectedness to nature, to other people, to the universe, and that these changes would, if they were more widespread, would benefit society. And it seems like that they would. The challenge then becomes, though, how do you prescribe a drug to a society? You know, we have only one model. Well, we're about to get another with the vaccine, I guess, but we have the model of fluoride, you know, which we put in the water, and that is a public health benefit. Most people agree on, not everybody. But I think that it's not clear that giving psychedelics to everybody would be a good idea. it led to the backlash when Timothy Leary promoted it. It's a frightening idea that you're trying to change society by widely introducing psychedelics. And it might not be true. There are all these suggestive studies that one experience on psilocybin, for example, will increase your sense of nature connectedness. The degree to which you feel you're part of nature, not standing outside of it. That's intriguing, but I don't know if, like, you gave the drug to the Koch brothers or Trump, that it would necessarily work out that way. I mean, my sense is they probably increase inclinations you already have rather than completely turn over your worldview. I'd want to see some good research before we gave it to people like that. So the other idea that was very current in the 60s was, give it to everybody, turn on, tune in, drop out, and you'll change society. And Timothy Leary even had calculated how many people you had to turn on to LSD to change society, like 3 million or something like that. And by the way, LSD did change society, but then you had other people who thought the better idea was to give it to the influencers in society. And this was Huxley's idea, Aldous Huxley, the writer. Give it to the businessmen and women, give it to the computer engineers, give it to the poets and writers and scientists, and let that consciousness filter down to the whole society. So that was another way. I agree, we have widespread trauma. I think we've been traumatized by the virus. I think we've been traumatized by the government over the last few years. But I think the model still has to be that we treat people one by one. I don't think we have a good model for how to treat a society with a drug or even with an experience.
Thank you so much.
You're welcome.
Thank you. I think Charlotte has the next question.
Hello, thank you for talking today.
Sure.
So you started to touch on my question in which you were talking about how these experiences are very much ineffable. We don't really have the vocabulary to convey the depth of meaning that you encounter during these experiences. So I was wondering how you think that we can improve our ability to convey these transformative experiences. And given that these are going to be given in therapeutic contexts, do you think that it's even important that these are shared, or that it's more just in the eye of the experiencer that it really matters?
I think narrative is really important to psychedelic therapy. From my own experience, things would happen. I would have an experience and it would be very confusing. I'd be like, I don't know what just happened. I don't know what it means. I don't know how to apply it. And it was really, I would come home after one of these days and have dinner with my wife, and I would tell her the story of what happened. And the creation of a narrative is a processing of life, because life is not as linear as narrative is. It's not as comprehensible as narrative is. And so this very interesting process of editing goes on as you try to tell someone else what happened, as difficult as that can be. And then, of course, you do this the next day in a integration session. And an experience that in the immediate aftermath was just disorienting, weird, suggestive, ineffable, becomes something usable in the course of telling that story. Sometimes with prompts from the therapist, or in my case, my partner, but other ways as well. And so I think we want to get people, I think it's really significant that in most of the clinical trials that I've written about, the volunteers were required to write a written account of what happened to them. And I think that's a really valuable exercise. I was doing it kind of for literary reasons, because I wanted to preserve this, because I was going to be writing about it. And then after that session with my wife telling the story, I would sit down and write 1,000 words about what happened. And it completely shape the experience in a way that, was untrue to the experience, which was much more of a mess, but nevertheless made it more usable. So I think narrative is a very important part of psychedelic therapy. I mean, I think it's an important part of life, but I think it's especially true in psychedelic therapy. And just confronting that ineffability problem is worth doing.
Thank you.
It's a great question. Thank you.
Thank you. I think we have Leah Waltrip next.
Hi, thank you so much for being here. I wanted to ask you, you mentioned that you didn't know if the reason that psychedelics were so effective was due to the experiential or the mechanistic impacts of it. And so I was struck by that. And I wanted to understand how you believe that you can separate the two, or if you believe that you can separate the two.
I mean, basically, you can't separate the two, because any kind of experience we know changes the brain in some ways, right? I mean, the brain gets new connections are formed, new pathway. I mean, it's called learning, and it has a physiological counterpart. But I think it's a matter of emphasis. One interesting, Roland Griffith at Hopkins had one interesting hypothesis, or one way to think about this. And he said, it could be that in the same way that trauma changes the brain, and we know, and that's an experience, right, that changes the brain. Why couldn't the brain be changed by other kinds of experience, such as a powerful positive experience? People who have psychedelic experiences say it's the top 1, 2, 3, 4 experiences in their lives, comparable to the birth of a child or the death of a parent. And in the same way that negative experiences leave a very deep imprint on the brain that I think you can measure, it may be true that a positive psychedelic experience can do the same thing. It seems to me that the evidence for the more experiential emphasis is, at least in psilocybin therapy, I'm not so sure about MDMA therapy, is that the people who don't have the powerful mystical experience that they look at, and they measure with the mystical experience scale, don't get the benefits of people who say have had an interesting psychedelic experience, but they didn't score high enough to have had an official mystical experience. Those people don't give up their addictions as quickly, or those people don't give up their fears and depression as quickly. So you can correlate the intensity of the experience with the outcome. And that's another argument, that it is going through some sort of mental experience that seems to be the therapeutic agent. But it may have its counterpart in some brain changes. We may see that, but I don't think it's determinative. I think that there's so much evidence that it's the nature of the experience that is really the shaping influence.
Thank you so much.
Great. I think we have one of our collaborators, Dr. James Rucker, here to ask a question.
I am here. Hi. News of your talk has spread. Hi there. Nice to meet you. News of your talk has spread over the Atlantic, so I'm in London.
Great.
Collaborating with Rachel, I work on clinical trials with psilocybin. And I'm really curious to know your opinion on this question, and I apologize if you may have spoken about it already. But do you think that Western medicine can be a container for drugs like psychedelics?
Yes, I think that it can be a very good container. I mean, it's showing itself to be. I mean, we're seeing in the people who are getting, psychedelic therapy for several different indications, getting good results. It's an interesting container in that it has, it hasn't been developed scientifically. It's kind of passed down through, here's what worked in the 50s. And one of the stories I tell in my book is how many amateurs were involved in the 50s in devising psychedelic therapy. People like Al Hubbard, who was not he's probably a spy and a rum runner and a gun runner and an all-around shady character, did more to shape modern psychedelic therapy than any person in a white coat. So the roots of the medical container aren't so scientific as you might think. And it's interesting that we haven't kind of validated the way we're doing psychedelic therapy yet. Maybe we will. I mean, so what about the eye shades? What about the music? What kind of music? All this stuff hasn't really been optimized yet, necessarily. So what I'm suggesting is the medical container is not over here, and then there's, do you know what I mean? It's drawn from the quasi-cultural container, I guess I would say. But yeah, I think the medical container is a really important one. I think to the extent that it doesn't feel medical, it seems to work better. I mean, that the environments, I mean, you've been in some of these treatment rooms, I take it, whether at Imperial College or Johns Hopkins, you feel like you're leaving the medical offices and you're entering another kind of space. They're not usually Buddhas on the shelves or in medical office suites. So there's an attempt to create a very non-medical feeling container within that medical world, and I think that makes good sense. I mean, one of the mistakes in early psychedelic therapy was that some guy in a white coat with a clipboard administered the drug and left you alone in a room with bright white fluorescent lights. And lo and behold, some people had bad experiences. And that it was actually Al Hubbard who said, you got to create a living room environment, bring in flowers, have paintings, visual stimuli and auditory stimuli that take you out of the space you're in. So yeah, it's a medical, non-medical container.
Thanks so much.
Sure.
Thank you. I think we have Alexander Deschamps next.
Hi, Michael.
Hey, Alex.
I was wondering if your experiences with psychedelics changed your relationship with food or writing, or anything else you were an expert in before taking the psychedelic.
The most powerful effect was on my relationship to plants. I had a couple experiences where I saw plants as having more subjectivity than I ever had. Now, this is an idea that I was disposed to. I'd written a book called The Botany of Desire many years ago, which really looks at, it's called The Plant's Eye View of the World, and looks at coevolution as a two-way street, where not only do we act on these species, but they act on us. Plants have changed the course of our evolution as we've changed theirs. And it was an intellectual conceit. I mean, it was rooted in Darwinism, but I didn't feel it in any sense. And I had an experience with psilocybin in my garden, an unguided experience. And suddenly all the plants in my garden had a very strong point of view. They weren't talking to me, but they were regarding me. They were returning my gaze. And I felt part of nature to a much greater extent than like most people in the West, I have a relationship to nature, which immediately tells you, wait a minute, you're standing outside having a relationship to nature? No, you are nature. We know that intellectually, but we all feel as humans, we stand outside, or most of us do. And I felt more inside than I had ever felt. I was just one creature among many in this garden. And it was an amazing experience. But I would say I was inclined in that direction. It was basically making felt what had been understood, not a complete transformation. So I think for me that was a really powerful legacy of psychedelic experience.
Thank you.
This might be our last question, unfortunately, but we have Colin Spencer.
Thank you so much for coming on. I think that as a journalist, you sit in a very sort of unique position of being able to sort of communicate to the public As a young scientist here, as a PhD trainee at Sinai, I have a really big question, which is, how do we as scientists begin to recontextualize the general public's perception of psychedelics with the current renaissance of its therapeutic potential? And do you think it really falls upon young trainees now to create the environment where we're able to share these experiences more openly with the public?
This goes back to this question on whether researchers should have the experience. I think it's helpful to you as a clinician to have the experience. I think to know what someone's going through can make all the difference. But in terms of dealing with the public, I don't know that if the impression got around that psychedelic therapy was being promoted or driven by a group of doctors who had all tripped, there you are, Colin, would necessarily help. I think that group of doctors would be snickered at by other doctors. I just think, from what I know of the culture of medicine, I think that the image of objectivity and disinterest is very powerful, and that if you had lots of doctors, telling their story of how their lives were changed and they were enlightened by psychedelics, I think it could contribute to a backlash, actually. So I'm not sure that that sort of conversation on a general scale would help. But then you're also talking about there's a cost in people having an experience they're not talking about, and that medical professionals all are going underground to have these kind of experiences, or they're not talking to anybody about it, and that's a problem too. I think what you're addressing, or your question addresses, is this transitional moment we're in, where we have a culture, part of the culture understands the power and value of these medicines, and then a much larger part of the culture is still really skeptical. But before I got involved, I was very turned off by people who were proselytizing, who were evangelical about psychedelics. That was a real turnoff. In the same way, someone comes to you and said, "I've seen the light. I understand the meaning of life." These are annoying people. So we don't want to be in that camp. I think that we need to remain, part of your authority as a doctor comes from this cultivated objectivity. So I don't know. I'm fishing around what I think about it, because I also recognize the danger of hypocrisy. But as a tool to make psychedelics more acceptable, having lots of doctors have the experience and talk about it, I'm not sure it's the best tool. I think you should lead with your patient's experience and encourage them to write and speak. And nothing is more powerful than the testimony of someone whose life has been changed, one of your patients or a volunteer. For me, that was transformative. And I think for a lot of people it is. And we're seeing in some of these documentaries too, where you hear the testimony of individuals. Those people are more like the people you want to convert anyway than you are. So I think we should be getting their stories out.
That's really incredible perspective. Thank you so much.
You're welcome. Thanks for the question.
Oh, I think we might have to end soon. I don't know if Rachel, you have anything else you wanted to say. Thank you so much.
No, I would just thank you for your interest and the work you're doing. I think what an exciting time, and you find yourself on the cutting edge of something that really could revolutionize the field. It has that potential. I think we all have to realize, though, and be respectful of all the people out there who think what you're doing is crazy. And that, we have to honor their reluctance and bring them along in a really organic way through good storytelling and good science. It will happen, but we shouldn't be beating people over the head.
Well, I just want to say once again how exciting it was to have you and to have this conversation. And I fully agree, we're in a transitional moment. And it'll be fun to visit this a year from today. So much has happened even since last year around this.
It's remarkable how fast it's unfolding. Yeah.
Absolutely. But tools for healing, that's something that we just can't say no to right now. We have to do the work and see what we've got. So I want to thank everybody for joining us. I want to thank you again for giving us your time, and hope to meet in person one day.
I look forward to that. Thank you, Rachel, and thank you, Lauren, and thanks to all the great questioners.
Okay.
Take care and good luck with your work.
You too. Bye-bye.